The problem is much more common than most people think. Actually, about 1 in 3 women report urinary incontinence, and it's very prevalent across age groups. It does increase in prevalence and severity as women age, but even women in their 20s report urinary incontinence. It has a number of psychological effects. It increases social isolation, it decreases work productivity, it causes frustration, embarrassment, anger, and has a really significant negative impact on quality of life. And this has been shown in many studies. Also, thankfully, treatment of urinary incontinence increases quality of life. There's stress urinary incontinence and urgency urinary incontinence. Stress urinary incontinence has the main symptoms of leakage with activity: coughing, sneezing, laughing, trying to exercise. Whereas urgency incontinence is leaking on the way to the bathroom with a strong urge. I would say that the mainstay of therapy, the first-line treatment for both of these conditions, includes lifestyle modifications, watching what you drink, and also pelvic floor muscle exercises. There are a couple different ways you can do pelvic floor muscle exercises. You can do them on your own, or you can do them with a pelvic floor physical therapist, and there are also some home exercise devices on the market. Other treatments that we commonly use, something called an incontinence ring, which is sometimes called a pessary. It's like a silicone ring that goes into the vagina and can help stop the leakage of urine. There are also office treatments in the form of periurethral bulking, which is using a cystoscope to inject a substance around the bladder neck opening. And then finally, there's an outpatient minimally invasive surgery called a suburethral sling, which is either the patient's own tissue or a graft that goes underneath the urethra. Again, all of these treatments are aimed at increasing the bladder outlet resistance so that it's harder, so that the leakage doesn't happen as commonly.